This very kind and nice follower of ours on TikTok flew all the way from Florida to California to see us regarding this tooth number 14. And when he first came to see us from Florida, it was 14 months ago. Regarding this tooth number 14, according to him, the root canal was done originally 30 years prior by a different dentist. And then when the tooth started to hurt him, bother him, root canal was redone by an endodontist in Florida. The endodontist had gone through the crown and had redone the root canal for him. Patient says a few weeks prior to him seeing us, he noticed some tenderness and then also noticed a pimple on his gum. So went and saw an endodontist in Florida, and that endodontist recommended an apicoectomy on tooth number 14 after examining the tooth and taking radiographs and all of that stuff. Did not recommend endodontic retreatment, non-surgical endodontic retreatment, but that endodontist had recommended an apicoectomy on this tooth. So patient says, because he follows me, he's not even a dentist, because he follows me on TikTok and watches all my videos, he was so educated about what's going on that he just said it didn't make sense to him what the other endodontist had told him. So he flew all the way from Florida to Sacramento, California to see us regarding this tooth. So we went ahead and examined the tooth. It was endo-access through the crown was restored with composite when I saw him. As you can see, 14 months ago. And tooth was tender to percussion, palpation. Probings were 2 to 5 millimeters all around. Okay, let me show you clinically. This is the tooth right here, and you can see a sinus tract right on the buccal of the tooth, right there. That's the sinus tract right there. But this area, mid-buccal, where the sinus tract was, it probed 2 millimeters. So we went ahead and traced the sinus tract and look where it's going. Right in this area here. That's where the sinus tract wants to go, right here. Take a look. And take a look here. It looks like the previous endodontist was trying to look for an MB2 and perfed right there. You can see that radiolucency right there. This is my tracer through the sinus tract, and that's where it wants to go, right there. So, and that's the area that corresponds to the buccal sinus tract. So as you can see, also the canals were filled short by the previous endodontist. So anyways, we discussed options with the patient, and patient wanted to try to see if tooth could be saved. He just didn't want to extract the tooth and do a dental implant at that time. And that's what we did. We went through the previous endo access, removed all the gutta percha, and lo and behold, there was a strip perforation there, but we were also able to find a missed MB2. So the MB2 that previous endodontist was trying so hard to find and couldn't find, we were able to find it. And of course, we work under a surgical operating microscope, and I was able to right away see that strip perforation there. And by the way, noted purulent discharge from that area. So this was immediately after we had completed redoing the root canal. As you can see, we're able to regain patency in all the canals. I decided to go ahead and obturate the entire mesiobuccal root with MTA along with the strip perforation. So this is all MTA here. And repaired that strip perforation with MTA also. All right. And as you can see, here's the date, about 14 months ago when we had redone this root canal. And patient left. Patient went back to Florida. And this is the 14 months post-op of tooth number 14. So let's call our patient Mr. X. Mr. X came back to see us a few days ago. He needed a couple of more root canals, so he flew all the way from Florida to Sacramento, California to see us again. And that's the 14 months post-op of tooth number 14. He had no complaints. His symptoms all had gone away. And that's the x-ray we took. And as you can see, here's the date. So 1 year, 2 months approximately, 1 year, 3 months. Anyways, 15 months post-op of tooth number 14. As you can see, no periapical lucencies. We remember repaired all of the perforation, that area there with MTA, and redid the whole root canal, so you can see no periapical lucencies whatsoever. And let me show you this was the clinical presentation of the tooth number 14 right here, and you can see a sinus tract right there on the buccal of the tooth. That was when, where's the date? That was when we saw him, January 24th, 2023, right? And let me show you. Let me pull to this side. I don't want you to see his face. Thailand. All right, take a look here. So this was when we first saw him, that sinus tract right there, you can see, and that's the date. And this was just the other day, and here's the date. So 1 year, 2 months later, the sinus tract healed completely, went away. If I zoom out, yeah, maybe not. Okay, so this was when we saw him before we rendered endodontic retreatment. You can see the sinus tract there, and this was just a few days ago, so 14 months post-op. He still actually has the same crown. My temporary filling was replaced with composite, and I told him, I said, you don't even need a new crown, don't get a new crown. Just leave it be the way it is. So he didn't even have to pay for a new crown. We went through the crown, redid the root canal, and did all the perf repair and everything. And then a dentist here in Sacramento was able to get him in before he left. I told the dentist, you need to put a rubber dam on before you remove all my cavity and all that stuff. I don't want my hard work to get ruined, contaminated and ruined. And the dentist agreed. Anyways, so he still even has the same crown, the same one that we went through to redo the root canal. Anyways, so one year, 2 months, 14 months post-op of tooth number 14. You can see the sinus tract is healed completely. Tooth is in full function. Patient has 0 symptoms. And I was actually worried about him. He might needing a period treatment because defecation was involved, but you can see that actually defecation was repaired too. Like once we took care of the endo, perio was taken care of by itself, so he doesn't even need to be seen by a periodontist. And these are the radiographs side by side. That's from 14 months ago, before we redid the root canal for him. And that PA is from a few days ago when we saw him for his 14 months post-op. So 14 months ago, before we redid the root canal for him. And here's the date. And just a few days ago when he came in for his 14 months post-op and for us to look at a couple of other teeth. And here's the date, as you can see. So same gentleman who flew from Florida to California to see us for endodontic retreatment of tooth number 14. Also needed endodontic treatment on tooth number 19. There's a crown on the tooth, as you can see, periapical lucency here. Tooth was tender to percussion and palpation. Probings were 2 to 3 millimeters. So cold, no response. Number 18 within normal limits to cold. Number 19, no response to cold. You can see again periapical lucency here. So we discussed options with him, and he flew again all the way from Florida to California to see us, and we went ahead and started and completed the endodontic treatment through the crown. We went through the porcelain crown, and take a look. Five root canal systems, 5 of them. So you can see 3 mesials. That's the middle mesial. Look at that beautiful anastomosis there. 3 mesial canals, 2 distal canals. Look at that really nice lateral. There's a lateral lesion here. And look at that nice lateral right into that lateral lesion. So everything went great, as you can see. We temporized the tooth, and he's going to go back to his dentist to have the tooth permanently restored. But 5 canals, as you can see. So you got to look for these middle mesials, and you can see all of that anatomy there, there, all that anastomosis. All right, so. And the same gentleman, our friend now, who flew from Florida to California to see us 14 months ago for endodontic retreatment of tooth number 14 that we just did tooth number 19 on. Also went ahead and redid the root canal on tooth number 12 as well. So according to him, an endodontist in Florida took a CBCT of this tooth and noticed the periapical lucency. So we went ahead and redid the root canal for him. These canals, as you can see, they were obturated very short, and it looks like perhaps maybe there's something going on there. Anyways, the reason they were obturated short is because these canals were extremely long, and I think the dentist who did the root canal kind of freaked out, panicked, didn't know how to manage long roots like this. So he basically ledged and blocked himself. That's why these canals were filled short, because he just didn't know how to manage these long roots. So we went ahead and went through the crown, removed the gutta percha, and we have tricks, of course, up our sleeve, and we know how to manage these blockages and ledges and what have you, and we were able to redo this root canal for him optimally in one appointment. And take a look. And here's the post-op. So we were able to bypass all those ledges and blockages, and you can see perfect obturation there, and we got a beautiful lateral here as well. So as you can see, everything went great. We went ahead and temporized the tooth, and patient will go back to his dentist for the permanent restoration. But as you can see, this endodontic retreatment also went beautifully. And again, you can see that nice lateral there. And he